Hi, Karen. You okay? Good afternoon, everyone. Welcome to our Tuesday COVID-19 update briefing. And you'll be seeing and hearing from Dr. Gail Burstein, and as you are already seeing, Karen Gambino from Deaf Access Services is here to provide the American Sign Language today. We have a very busy agenda ahead of information to share, and then we'll open up to questions as always. Latest COVID-19 data as of yesterday is what we released yesterday, which was through April 4th. Confirmed now 75,937 unique COVID cases. These are not duplicates, so those are 75,937 separate residents of Erie County who have been confirmed. 3,223 total new cases in the last 7 days, which is increasing as we'll talk about. 351 total new cases per 100,000 past 7 days. That is also increasing. That's not good. Hospitalizations as of April 4th. There were 240 people hospitalized in Western New York hospitals, 64 of them in the ICU. As it pertains to Erie County hospitals, there are 218 patients, 58 in the ICU, 35 on an airway assist. Thankfully, nobody died on April 4th, though we have had deaths recently in area hospitals. And when it comes to the patient numbers, they are going up. This is the last 2 weeks as we look at it, and you can see on March 22nd, there were 148 patients in Erie County hospitals, and there are, as of April 4th, 218. A little over 60% of the hospital beds in Erie County hospitals are occupied. COVID-19 hospitalizations have increased by 47% in the last 2 weeks, and 53% of those that are hospitalized in April 4th were age 64 and under. So it's not just older people, and as we've vaccinated more older people, and we'll talk a little bit more about that, we've done a very good job of vaccinating people 65 and above. Not surprising that people that are younger are the ones that are being hospitalized. And thankfully we have the vaccine. If we didn't have the vaccine, I'd hate to know what these numbers are right now, because we do have a number of the variants in our region. The confirmed cases the past 6 weeks, they are the highest they've been in quite some time. 3,182 in the last the period that ended April 3rd. So this is as of the week ending April 3rd, 346.2 new cases for a 7-day average for 100,000 persons. You'll see that number going up. It's an important number we'll talk about with regards to high risk of transmission, and it's still going up since that date. And all Erie County zip codes have more than 200 new cases in the past 7 days per 100,000 residents. That is also very important as we talk about what is determined to be a high risk of transmission. So this is a line graph of the 7-day average of cases since March 21st, and you see it was less than 250 on average on March 21st, and now it is 350.7 or 351 as of April 4th. It has steadily increased. The CDC identifies a region as high risk of transmission if there are more than 100 new cases over a 7-day period per 100,000 residents. We are at 350.7 for a 7-day period for 100,000 residents. So we are 3 times worse than what the CDC notes as a high risk of transmission. And as we're seeing, it's going up. I know people are sick and tired of COVID. I know a lot of people have been vaccinated. We're seeing cases primarily among individuals who haven't been vaccinated. COVID has not left the area, and there are variants in our area, as we talked about and released last week. 4 variants that we know of, 2 Californian, 1 the UK, and the 4th, a New York City-based one, that are all a higher risk of transmission. So we're very worried about what this means for our region in the next few weeks. Thankfully, we've vaccinated a lot of people in our community, because if we hadn't, I'd be very concerned. And all you got to do is look across the river and seeing what's happening right now in southern Ontario, where they're basically on another month lockdown. They have not vaccinated their percentage of the population as well as we have. And I feel sorry for them, because they're dealing with some of these same variants that we are, and they are in a lockdown again. Thankfully, we're not in a lockdown, but we are not in a great situation when it comes to COVID. And you can see it here by looking at this graph which shows the confirmed cases in total since the beginning of the pandemic. We haven't really shown this in a while. But you will see the beginning of the pandemic in the first 9 months, we had much lower daily cases of coronavirus. We were shut down for a good portion of it, so there's a reason why. But it's not as if we are in a better spot than we were even last late summer, early fall. You will see that up until basically November through January, where we're in a worse situation, and we are in what we believe to be a new wave. Call it a third wave, call it a fourth wave, depending on what's happening across the country, but there is definitely a new wave of COVID-19 cases that are increasing, hospitalizations that are increasing, that we believe are being possibly driven by the variants, the 4 variants that we know of that are in this region. And as we identified last week by press release, fully 1/3 of all the cases that were identified by the University of Buffalo School of Medicine's Genome Institute identified them being variant-based. So we know that there are much more highly transmissible COVID-19 variants that are being passed in our community, and as we get more information from UB, we expect that percentage of variants to be even higher, such that it's 50% or more fairly soon. But all you got to do is look at that graph, and you can follow it pretty easily to see we did see a fairly nice drop starting in late January and February, and then we saw the increase in March, and we are going up again. And that's not good because, remember, a large portion of our population has been vaccinated. This means that this is affecting a much smaller portion of the population than just last October and November. New COVID cases by zip code week ending April 3rd, they are all high. It wasn't that long ago when maybe we had 1 or 2 zip codes in the 100+ cases, and now we've had many more in the raw cases, but you look at it per 100,000 in the last 7 days, and it's pretty high. They're all over 200, as we noted, and some of them are in the 400 and above category. So it's just not great out there. I know people are sick of COVID, they're over it, but the pandemic's not over. And I need people to hold out for a little longer until we can vaccinate more individuals. As we'll show, we've vaccinated a lot of individuals. We're above the state and we're above the federal average for those who've been vaccinated with first and completed regimen doses. But we're not where we want to be just yet, which is everyone who's eligible gets one who can get one. And until that point, we still have to be careful. Because while nobody died on April 4th, we have seen a number of individuals die in hospital recently from COVID-19. And it is disappointing because those are all preventable deaths. Cases confirmed by age groups, we are seeing that it's being primarily driven by younger age groups. For the week ending of April 3rd, there were only 60 new cases in the 80+ category, 90 in the 70 to 79 category, but there were 535 new cases in the 30 to 39 age category. There were 714 new cases in the 20 to 29 age category, and there were a combined that would be 659 new cases in the 0 to 19 age category, so basically school age. We are seeing COVID-19 among younger individuals as they are spreading it amongst themselves. And as Dr. Burstein will now talk about, after we go through this final thing on the positivity rates, we had one of the highest numbers as it pertains to raw cases in schools in Erie County for 1 week in this past week. So as we see here, the cases are primarily being driven by younger individuals, and that number has been increasing. It is not totally out of the realm of possibility that there's been younger individuals that are the preponderance, or not preponderance, the larger percentage, I should say, per age category, but it really is showing it now, as you can see with the highlighted yellow areas being basically age ranges of 0 to 17, and then 18 to 22 is actually much better. This is just younger people are, based on our positivity rates, are much more likely to be positive than they are if they're older. And that turns it over to schools, so I will turn it to Dr. Burstein to talk about what we're seeing in schools. But as you can see from the chart, it has really increased in the number of new positive cases in a 1 week period in schools.
Thank you. Good afternoon. I just want to point out that with looking at the proportion of positive tests in our younger people, just want to point out that the denominator, the number of youth tested every week has been pretty constant. So that proportion of positive tests really reflects an increase in the numerator. We're seeing an increase, a number of kids under the age of 20 every week that are testing positive. So that is a concern, and it is, the county executive mentioned that this is really reflective of what we're seeing in the schools. So this last week, ending on April 3rd, there were 504 cases of primarily students, some staff, but primarily students affiliated with schools pre-K through grade 12 that were COVID positive. And that's a huge jump from the week before, when that did break our record of 306 cases, again, primarily students. So the epidemiology of COVID-19 has changed in our community. We're seeing it many more cases in young people, and we're seeing more transmission among young people too. So it's just, and we're seeing more sick kids. So it's just not a matter of kids don't get sick or kids don't get infected. I don't have to worry about my kids. We have to worry about our kids. We have to play it safe. And that brings us to youth sports. So one of the sources of the cases in the schools are team sports, because we know that in the Buffalo area, Erie County is a big sports area, and that's great, healthy thing to do. But right now we're seeing outbreaks among the sports team. So far, since February 1st, since we started following youth sports for outbreaks, there have been 165 teams that have been placed on pause by the Erie County Health Department. So that means there are at least one person on the team, either a player, an athlete, or a coach or a staff person, who tested COVID positive out of 165 teams so far. Of those, hockey accounted for about 40%. And then of right now, there are 24 teams as of today that have been put on pause. And of those, 6 teams have been placed in quarantine. So that means there is spread within those teams. And then, unfortunately, talking about the mortality data, and it is sad. We are still seeing deaths from COVID-19 in our community. The good news is that where we know that many of the deaths are among our seniors, especially those 70 and up, and as the county executive mentioned, that many of those individuals have been vaccinated. So the vaccine is working. It is preventing serious illness and hospitalizations, as we saw, and it's also preventing death among our elderly. So in March, we've seen a significant decline in deaths compared to February and January. So that's good. And another thing is since the beginning of the year, there's been a small trend in a decreasing average age of our victims of COVID-19. So just in total, since we started counting mortality as of March 1st through last year through April 1st of this year, there's been 1,740 deaths, and that's 1,274 in 2020 and 466 so far in 2021. And again, we reach out to those families and good friends of those who've lost their loved ones. We're really sorry. And however, we're doing a lot to prevent future deaths. And so speaking of that, I'm going to turn it over to our county executive to talk about how the Erie County is responding.
Thank you, Dr. B. Vaccine clinics. We have multiple clinics going on usually every day. In fact, we actually have 3 sites that are active right now. 2, one at the Key Bank Center, one at SUNY Erie North, and a 3rd pop-up clinic at the Greater Refuge Temple Church in Buffalo. Usually we have at least 2 and sometimes 3 clinic locations going on any day except for Sunday. We work every day except for Sunday. The regular clinics, of course, are at SUNY Erie North, SUNY Erie South, Key Bank Center, one-day pop-ups like the Greater Refuge Temple today. All locations are by appointment only. Sometimes we have openings. Actually, last night we announced that there were openings for the pop-up clinic that we have in the city of Buffalo today at the Greater Refuge Temple. So you got to keep an eye out. You never know when we might actually have openings associated with these. It's not always if we schedule them 4 weeks in advance, because what we do is we do not schedule pop-up clinics and most of our first dose clinics until we actually have the doses in hand. So sometimes we'll just schedule them like that. So keep an eye on our site, and as we'll talk about very soon, that'll be opened, and the state sites. We had hoped to have the new county online system operational as of yesterday and open. It is in beta testing, so it's close. The goal is to have it next week. So Microsoft gave us it. We're working on it. We're working on the kinks because we don't want to open it up to the world and have it crash. We know what happened when the state system did that. So we are doing beta testing right now, and if things go well, it will be open. Our new online portal for scheduling doses for first doses will be available, we believe, next week, as well as the phone appointment system will also be available next week. So I just want to let everybody know we'd hoped to have it start today. We got it, but we're feeling that we needed to do some beta testing through the week to make certain that it's okay. So far, it seems to be working good, so that's a good sign. We're training individuals on it so that the individuals will be able to schedule it who are taking the phone calls and others internally, so we know that it works right. But we're close, but we're not there yet. I'd hoped we would be. We have it. It seems to be working, but it's in beta testing right now. Now, this is important to know. We've talked a lot about doses, how many doses we receive on a weekly basis. We know for this upcoming week we're going to get 8,000 doses, 6,700 of the Moderna. We started getting Moderna again last week, and 1,300 doses of the Johnson & Johnson. We will not be receiving Pfizer this week, nor will we be receiving Pfizer next week, we've been told by New York State, which is important because, of course, New York State increased the eligibility for anyone 16 and above can qualify. So it doesn't matter what you were, where you work, everyone 16 and above can qualify. However, only the Pfizer vaccine is authorized for 16 and 17-year-olds. The Moderna and Johnson & Johnson vaccine are authorized for 18 and above. The Pfizer is authorized for 16 and above. So what New York State has told us is once we run out of our supply, they're not expecting that we're going to get more Pfizer in the next couple weeks. So if you are trying to schedule for a 16 and 17-year-old, you're going to probably have to look at the state site or the state locations for vaccinating the 16 and 17-year-olds in the next couple of weeks. We are expecting to receive at least 8,000 and possibly more in the next week or so. However, we're probably not going to get any Pfizer. So if you have a child that is 16 or 17 you're trying to schedule a dose for, you are in all likelihood going to have to go to a state site. We're just finishing up the Pfizer doses that we had remaining from last week. We expect to run out of those in the next day or so. So unfortunately, it's doubtful that we're going to be able to do 16 or 17-year-olds at our Erie County clinics later this week or next week, just because of the lack of receiving Pfizer. Eligibility does not mean availability. Availability is increasing. That is a good thing, but we know it is not sufficient to meet the immediate demand. People are getting an opportunity to schedule. There's much more opportunity to schedule now, and we're very happy about that. But we also know that when you're talking about everyone 16 and above qualifying for a vaccine in Erie County, now we're looking at least 700,000 total people. And we still haven't finished some of the categories, though we've done pretty good. But at least 700,000 people qualify. Not everybody is getting vaccinated, but that's still a lot amount of people who can qualify. More people in the 20-year-old category are now qualifying that weren't there last week. So there's still more demand. We're trying to meet it. We just haven't gotten there yet because we are still not receiving the total amount of doses on a weekly basis as we would like. There are other vaccine websites. The state site, of course, Am I Eligible? Just type in Am I Eligible New York State and you will find it. It's one of the first things that pops up on the internet. It was announced last week, vaccinehound.org. It's maintained by volunteers, hosted by the University of Buffalo. It's for all of Western New York. They identify when new doses become available, so check the Vaccine Hound. Hopefully the Hound will sniff out an appointment for you if you haven't been able to schedule one yet. But like everything else, these doses or these appointments go very quickly. So if there's 150 appointments available, it could get shared real quickly and disappear within less than an hour. But check vaccinehound.org. Vaccinefinder.org is a joint project of the CDC and healthcare facilities that also will identify some that sometimes we don't know about right away. So those sites are also available. And to give you an update on vaccination totals through April 5th, we have, as a community, seen 36.1% of all Erie County residents have received a first dose through April 5th, which is approximately 45% of all adults. Remember, 16-year-olds did not qualify until now. So when we're talking about 332,138, we're really talking about a vast proportion of our population that was, until recently, at least 50 and above. So we've seen a big proportion of our population, at least 45% of all adults when you include the 18-year-olds and up, have received a first dose, and 22.2% have received a second dose or completed the regimen with the Johnson & Johnson. That's 28% of all adults. So a little less than 30% of all adults in Erie County have a completed vaccine regimen, and that's a good thing. It really is. I think it's one of the reasons why, as we're dealing with this new wave of coronavirus cases, it's not as bad as it was last January and December, though it's not good. It's certainly much worse with cases and hospitalizations than it was, truthfully, just a year ago. And then the Erie County Department of Health, we've administered a little less than 50,000 first doses, 48,811, and 34,559 second doses. Sometimes at our clinic, you'll see a first dose clinic on one side, and you'll see a second dose clinic on the other side at our location. So we're humming along, and it seems to be going really well. I checked out the Key Bank Center this afternoon. That was going well. People were really happy in and out, and I think we've got a really good system that's working across the community to get people in and out, and the most important thing is we're vaccinating thousands of people daily. We did over 2,300, I think, yesterday, and that's just an example of the good work of our team. Vaccine distribution by zip code. Once again, you see Gowanda the lowest. We don't really believe this number is 100% accurate because we know a good portion of Gowanda in the 14070 zip code covers the Seneca Nation, and the Seneca Nation has been receiving doses directly from the federal government. So the Gowanda number is a little off, and Irving, of course, is part of the Seneca Nation as well. Irving actually is a community in Chautauqua County, but we think those numbers are a little off, but you still see that Buffalo has some of the lowest vaccination rates for one dose, not two doses, one dose of all. It's disappointing to see it. So the urban areas, once again, are some of the lowest. Rural areas aren't great either. If you live in the suburbs, you probably have had a greater chance of getting an appointment or actually being vaccinated at this point. Except if you're the highest Buffalo is 14203, which is a very affluent section of Buffalo. It's not the equity we would like to see with regards to vaccine doses. So this is as of April 3rd, and if you are in a suburban area, you at least are usually over 30%. If you are in a more affluent area, like parts of Clarence, Orchard Park, Amherst, so those are over 40%. So we're glad to see that a good percentage of our population is getting doses across the community, but we are still very disappointed to see the numbers in the city of Buffalo and rural areas, and that's why we have pop-up clinics in the city of Buffalo and rural areas. Older adults, we have some good news to report. New York State has reported to us as of 2 nights ago, I believe, that 67% of let me backtrack. 67% of all New York State residents age 65 and above have been vaccinated. We think it's the first dose, not totally the second dose yet. But Erie County residents age 65 and older have been vaccinated is 70.6%. So we are actually above the state average. The New York State goal is to get 75% of residents age 65 and older vaccinated. We're pretty close to that, at least with the first dose and the completed regimen. So I think we're going to meet that probably in the next couple of weeks. And our goal, truthfully, is to vaccinate every single person who wants to be vaccinated. And if you're 65 and above, you should get a vaccine. You are more at risk for hospitalization and death than anyone else. If you're 65 and above and still questioning whether you should get a vaccine, get it. It's safe. I've had my vaccine doses. I haven't grown a third eye or anything like that. It's safe. It is like the vaccines we got when we were kids for measles and mumps and things like that. The syringe is tiny. I mean, I actually had a good point. Somebody brought up, said I should probably bring in show you the needle, because people think it's this giant needle that they saw in some TV ad. It's not. It's small. You won't even feel it enter your skin. Trust me. It is something we should all do, and hopefully each and every one of us will get vaccinated. And if you are hesitant, get it. If you're over the age of 65, please get it, because you are more at risk for death than anyone else. Now, if you lose your vaccine card, do you want to take this? Or? Sure. Okay, I'm going to turn it back over to the doctor. Because we've had some people reach out to us who've lost their vaccine card and wondered what to do.
Thank you, County Executive. Yeah, so, sometimes important pieces of paper seem to have legs and they just walk away. So what we recommend is when people do get their vaccine card in the clinic, we recommend you take a picture of it so it'll be on your phone and hopefully you won't lose that. Another option is to laminate it, make a copy of it and laminate that and then put it in a safe place, but don't forget where you put it, and so then you'll have a copy of that. However, if Plan A and Plan B fail, there is a good Plan C. Actually, all the data for everybody's immunization is New York State is entered into the New York State NICES system, the New York State Immunization Information System. So our immunization clinic at 608 William Street can tap into that. If you lose your card, give us a call at 716-858-7687. Press option 5, and that's for the immunization clinic. So we just need you to leave a message with your name, your date of birth, your vaccination date, if you remember that, at least the last one, and your phone number where we can call you back. And so we can look up your vaccination record. We have blank cards. We can fill them out. So all you need to do is then we'll give you a call when we have that completed, and you can come to the clinic at 608 William Street in the city of Buffalo and pick up the card. But please be sure to bring an ID so we know that it's really used. But it's really easy to replicate that. So don't be disheartened if you lose your card. I also want to talk about what we're seeing in terms of our case investigations, where we are seeing clusters, because we are seeing clusters. As the county executive mentioned, that with these variant strains in our community and what we think are growing numbers that are more easily transmitted in the community, we're seeing more transmission in places where people congregate. So we're seeing a lot of cases in youth sports. Hockey, as I said earlier, represents 40% of our youth sports cases. Actually, we've had, and you may have heard about an outbreak from over the weekend from Monroe County, a tournament. We have actually 4 cases here so far from that we're investigating from hockey. So we're seeing a lot in hockey. We've been seeing lately outbreaks in dance studios, cheerleading, football, volleyball, basketball. There's no sport that is safe. So it's really important to adhere to those safety guidelines. We're seeing, unfortunately, outbreaks in daycares, including the young children getting infected. We're seeing a lot of outbreaks in restaurants, churches, and then we're seeing a lot of outbreaks in small businesses. And what we're finding is that many small businesses are not adhering to the prevention recommendations that have worked in the past. So they're not, and they're allowing their employees who are ill to come into work because they're not getting screened. So please, reaching out to the businesses. We want you all to stay open. We want businesses to stay open and to thrive in Erie County. So please, before you let any employee walk in the door every morning or before the beginning of their shift, please screen them for illness and put a hard stop if anybody answers yes to any of these symptoms. Also, masking is very protective. It's as protective as vaccines if you wear them all the time appropriately. So please make sure that all your employees are masking. What is really important is that everybody knows their status for COVID-19. We don't know the cases. We can't do the investigation. We can't put close contacts in, find out if they're close contacts and put them in quarantine and isolate them from the rest of the community unless we know who is positive. So at the Erie County Health Department, we are able to test everybody with both a PCR test, so that's a molecular test, and a point of care test 5 days a week. And actually the point of care test we also do on Saturdays. So just give us a call. All you need is an appointment. It's 716-858-2929. We will test any Erie County resident for any reason. You just want to know their status. So, please give us a call. We want to help you know your status so you can be safer for yourself and the people around you. So I'm going to turn it over to the county executive to entertain questions from the media. Thanks.
Okay, thank you, Dr. B. Why don't we start with print media? Is anybody on from the B newspaper? Is anyone on from Buffalo Business First? If not, we will go to the Buffalo News. I think Tom Prohaska is on.
Yes, Mr. Poloncarz, I'm here. Thank you very much. Does the county have any plans to change its policies regarding the in-person school education, given the number of kids that have tested positive last week?
My understanding is we are still following the standard associated with New York State, which is the 6-foot guidance. It has not changed. New York State has not reduced it. Interestingly, as more cases are showing up among children in school, we've certainly had much less call for reduction in the distance between students. I was getting a lot of calls from superintendents and teachers, and now they seem to have backed off, I think, as they realize that there's this increase in cases. There's been no change. We've heard no change from New York State either. So for now, it is following the same standard. As is noted, the CDC has a standard of you really should be very careful and have children spread out as much as you possibly can while having in-class teaching. If you have a region that has a high risk of transmission of COVID-19, which of course is 100 cases over a 7-day period on average for 100,000 population, and as we noted earlier, we're at 350. So we are what I guess would be considered a super high risk of transmission, and there's no plans at this point to change the protocol, but we certainly are working with schools, and in recent past there are schools that have actually shut down and gone to virtual for 10 days based on the number of new cases that have materialized, some based on the recommendation from the Erie County Department of Health, some based on their own determination that just the safety needed to prevail, and so they shut down that school and went to virtual for 10 days, which is truthfully what should be done if there is an outbreak in a school. So we do thank those schools that have worked with us in that situation.
High school football resumed last weekend. Does the county have an opinion as to whether this football season should continue, given the new statistics?
It's no different than other sports. We treat them the same. If a player or coach tests positive, then they are going on pause. And depending on if there's multiple cases on a team, they may be quarantined. So high school football is no different than high school hockey or basketball. I do know that there are some cases associated with teams, including, I believe, my own alma mater, Lackawanna, was on pause because of cases associated with it. So I don't believe they actually played their first game due to COVID. It's just the world we live in, and I think people need to understand that that's what we're going to be dealing as we go forward. We're going to treat everyone equally. We're not going to treat any sport differently. High school football certainly has more players, so there's a greater risk of not only number of cases per an organization, but with having 11 people per team on the field, there's a much greater risk of transmission as well. So we're monitoring it all, and if there is a case on a player or a coach, they go on pause. And if there are multiple cases on a team, that team may find itself in quarantine. WBEN, Mike Baggerman. Michael, are you
Hi,
there?
Mark. Yep, can you hear me?
Yes, go ahead.
Okay. Does the county have any plans to go directly into schools in order to give vaccines to students who are 16 or 17 years old?
Not at this time, and as I discussed earlier, we are not going to be receiving the Pfizer vaccine in the next couple of weeks, so we wouldn't even have the vaccine to deliver to 16 and 17-year-olds. We would have to get a huge amount of Pfizer dedicated solely for students to do that, and as of right now, we've been told not only is there no requirement for us to do that, but we're not going to get the Pfizer, so we couldn't even do it if we wanted to. WBFO, Michael Desmond.
It's actually Emily Watkins today. Thank you so much for all the helpful data. I know you pointed out that you pointed out that young people are contributing to the rise in cases, and I know the University of Buffalo is talking about opening a vaccine site after SUNY announced that they'll be sending out Johnson & Johnson doses to their campuses. Does this increasing cases among young people, does that emphasize the need for young people to get vaccinated? And should vaccine sites be finding ways or prioritizing vaccinating young people?
Everyone who qualifies should get vaccinated, regardless of your age. You are much more at risk for hospitalization or death if you are older. But just because you're younger doesn't mean you can't be hospitalized, and we see individuals in the hospital that are in their teens right now. And you could spread it to someone else. You could spread it to a loved one who may not have been vaccinated yet. And we have seen cases of individuals who've been vaccinated who have caught it, and if the worst thing that most of them are dealing with is a mild form. But that doesn't mean they can't catch it again. So what we're hopeful is that everyone gets vaccinated, especially young. New York State opened up the eligibility to anyone 16 and above. That now includes people who in the 20-year-old age group who were not eligible beforehand. And there's still a lot of folks who are eligible now than we have vaccine available for. We have talked, I know our Department of Health has talked with the University of Buffalo about working with them to deliver vaccine clinic in the future for their students. I saw a report last week that Cornell University was the first university to require students to be vaccinated to return to school. So I think you're going to see a lot more of that, where students are going to have to be vaccinated if they're going to return to class. And as we move forward, I expect, and I talked about this earlier today on a conference call that we had internally, is that we're going to be spending a lot of months of the summer vaccinating children and college students. We think we're going to probably get most of the adults done by the end of May that want to get it done. But we think we're going to be spending a lot of time in the summer once they open up eligibility for younger children, vaccinating children. And the goal is to vaccinate them so they can go back to school in the fall. College, of course, starts in August here. Regular school starts in September. So our goal is going to be vaccinate everyone that possibly will qualify as soon as we can. And for students, if they're questioning whether they should get vaccinated, they should. They should for many different reasons, including their own health, because they can get sick, and there are individuals that are teenage age in Erie County hospitals right now that are COVID-19 positive. They probably won't die, but that's not to say they couldn't have serious after effects, long-term illness issues related to COVID later throughout the rest of their life. So no matter what age you are, you should get vaccinated. And if you're a student and you're thinking about it, if you go to college, your school might require it. High schools might require it for the fall. I don't know. That's a discussion that's going on right now. But everyone should get vaccinated, including the young. Spectrum News, Dominic Lavalo.
Hey, Mark, thanks. So obviously, even though 16-year-olds are now eligible, Erie County vaccinating them is going to be difficult. That said, with sports programs and high schools with 16, 17-year-olds, if there is a case connected to one of those teams, and yet one of those teams at some point would then be able to prove that most of the team is vaccinated, would there be a different type of restriction, or would there be less likely of a pause being affected because they had so many players vaccinated.
Dominic, the rule that we have in place is going to continue for the remainder of the school year. It's going to be very doubtful that 16 and 17-year-olds are going to get a significant portion of the vaccine through the remainder of April and May. There's still, as I think I said earlier, there's about 700,000 Erie County residents who qualify for the vaccine right now. And as we showed earlier, we've gotten first dose over 300,000. I think it was 350, so we've done about half of them. There's still a lot of adults that need to be vaccinated. I think it's premature to be talking about whether we'd be giving some exemptions to sports teams based on vaccinations. If you think about it, with the Pfizer, it's a 3-week difference. Moderna, it's a 4-week. So even if a student got vaccinated with their first dose tomorrow, they're still not going to get their second dose until the first week of May, and then they're going to have to wait 2 weeks after that to get full protection. So that's basically taking them to the end of May. We believe that there's a valid reason to keep the one and on pause protocol in place through the remainder of the school year for sports teams. And it's not just high school sports teams, it's youth sports teams as well, which might not be high school based. So we're going to be keeping that for the remainder of this year, and then we'll revisit it after we've been able to vaccinate a significant portion of the youth population, hopefully by summer. WIVB, Channel 4, Chrisravatas.
Hey, Mark. As you know, students are not in school this week, and a lot of families are on vacation. A lot of them may be in Florida or other areas. What you said yourself, our area is an area of high transition. But in any event, a lot of travel. And as you know, New York no longer requires a quarantine when people return to the state as of last week. I know when the governor announced that, it was kind of before this recent uptick in cases. And in retrospect, do you think that's a mistake? And would you still advise people who are traveling to get tested as they return home this weekend?
Well, the CDC changed its rules with regards to travel for fully vaccinated, saying it's safe to to travel if you're fully vaccinated. So if it's been 2 weeks since your second dose or your first dose, if it's the Johnson & Johnson, the only dose, it's safe to travel. For those who have not been vaccinated, they should get tested upon return. It's as simple as that. I'm hearing from some of my colleagues down in Florida that they believe the numbers are actually higher than what's been reported by the state. There's ample evidence down there of individuals who are sick with COVID-19. If you are fully vaccinated, it's safe to travel. That's what's been determined by the CDC. If you have not been vaccinated and you've traveled, you should get tested. Simple as that. Call our number, 858-2929, and we will schedule a test for you because we're fearful that those individuals are going to be bringing back COVID-19 from elsewhere. It doesn't take a genius to realize that when you're in an enclosed area, such as a plane for maybe 2 hours, there's a chance of catching it. If you're in an airport, a busy airport, there's a chance of catching it. If you're at a restaurant in an area where people are unmasked, where they have not been following protocols as well as we are, there's a chance of catching it. Heck, there's a chance of catching it in restaurants here, as we've seen. So if you have not been vaccinated, get tested upon return for your own health, your family's health, your coworkers' health. And if you have been vaccinated and it's been 2 weeks since your vaccination, CDC has determined it's safe to travel. So congratulations. I do know some people who have been fully vaccinated who went down to Florida this week and one in South Carolina, a family, and congratulations to them. We're working hard here. We're not going to take some vacation time for a little bit of a few months still. So it's another great reason to get vaccinated so you can travel. Think about it. If you've been fully vaccinated and you want to go visit family that are in Arizona or Texas or California, Florida, I've got a brother in California I haven't seen in quite some time. If you get fully vaccinated, you go travel and see them. So go do it. The alternative is you could still catch COVID-19 and get sick. Channel 7, WKBW, Eileen Buckley and Olivia Proya.
Hi, County Executive. This question may be for the Health Commissioner, but if you can
Sure.
answer as well. Do you know the transmission rate of those 500-plus school cases. Do you know if they were transmitted in the schools?
I do not, well, certainly not all of them were transmitted in the schools. I think some were, but Dr. Burstein could probably answer that better.
Helene, there are various sources of infection of our students and staff who are infected in the schools. We see a lot of people that are infected from close contacts in their home. As we mentioned earlier, we see a lot of transmission within youth sports. We see, sometimes kids have no idea where they're infected. Some kids have part-time jobs many times, and as I mentioned, we're seeing infections in, especially in small businesses. So I think there are multiple sources. If we do find transmission within a classroom, we work hard with the school to identify that cluster, and we recommend that the school closes or at least close the classroom if it's just isolated to a classroom. So we haven't done that in the past week. However, we're always looking for that. So unfortunately, I think the take-home message is that there are multiple sources of infection for our youth, and we wherever they are, at home, in sports, at part-time jobs. So we really have to be vigilant. Thanks.
Okay, WGRZ.
Oh.
We'll come back. We're going to do one round. So
Thanks.
we'll do WGRZ, and go ahead.
With the governor calling out Western New York for its high rates yesterday, have there been any talks with the states of any further restrictions that might have to be put in place because of the high rate?
I have not heard of any. There's been no discussion to my knowledge. I think everyone's disappointed to see the higher rates, and the governor did highlight Western New York as the highest right now. It's disappointing. It's not the first time that we've been in this situation, and I just hope we could do better as a community. But there has been no talk of further restrictions at this point from New York State. Adam Bonini, why don't we just go back the same order? Why don't we go Channel 2 again, and then we'll go back through TV to other media. Adam, are you still on?
Hi, Mark, can you hear me?
Yeah, I can hear you. Go ahead.
Hey, this is a non-COVID question. I hope you don't mind, but in light of what was reported last week on the stadium issue, I just wanted to jump in and kind of follow up with you. I know that something has been presented from PSE to you and to the state. Can you tell me where we are in that process? What your view of that entire situation is? Just kind of an update now that obviously COVID put things on hold for a bit.
Well, first off, Adam, nothing has been presented to us. It's my understanding PSE has received a report, but they have not presented anything to us. So there's been, I talk with a number of members of the Bill staff, either talking or texting a few times a week, and we have not set up a date to meet yet. They have not presented any report to us, and I just want to kind of get accurate information out there. I saw what Ron Racuvia had said, and Ron and I communicate a lot, but he agrees. He's not presented us with a report, and when that time has come, they'll present us with a report. But as we did in the 2012 and 2013 negotiations, we're not going to go into detail as to how the negotiations are going at any one point. But I wanted to clear up the air, so I'm glad you asked that question, because I've had some people say, what does the report say? And the answer is, I don't know, because I haven't seen it. And no one in Erie County government has seen it, and no one, to my knowledge, in New York State has seen it. And we are just starting a process that will probably take some time.
Am I allowed to follow up here? Sorry,
Sure.
This is my first time on the...
We'll give you a follow-up, first time.
The follow-up is, where is this, in light of all you're talking about with COVID and everything, what's your level of urgency, I guess, to kind of get things going and get to some resolution as part of this process is concerned right now?
I mean, the lease expires in 2023. It's 2021. So we're pretty much on the same timeline as I was when the lease expired in 2013, and we picked up negotiations in 2020 or 2012. So actually, we're ahead of where we were a few years ago. So these are not discussions that are going to be resolved overnight. And for those who think that a decision has been made already, no decision has been made. And when we reach an agreement, we'll announce that to the public. But I do anticipate it's going to take some time to get to that point. And I know we've got good partners in the Bagulas and their team. We have good partners in New York State. And it's going to be a long process. It's not going to happen overnight. And as I said, and you'll remember, in 2012 and 2013, we discussed where that we were negotiating and that discussions are ongoing, but we wouldn't go into the details. And that's the same rule we're going to apply now. Other than I did want to answer your question, because I think people seem to think that we have already begun negotiations and we have received documents from them, and the answer is no, we have not.
Okay. Thank you, Mark.
You're welcome. Chrisravatas, any more questions from Channel 4?
Let me ask Dr. Burstein a question, actually, and it's a follow-up to kind of something, Doctor, that you said last week. You said everything's opening up. We're kind of moving in the opposite direction we should be behaving. We're behaving in the opposite of how we should be behaving. Should I take that to mean that you think we're opening up a little too quickly, given the recent uptick in cases, hospitalizations, et cetera?
Well, Chris, just because a facility is open doesn't mean you have to go there. So I think what we really need to do is call out to Erie County residents, and that's why we're providing these press conferences and providing the information so that people will have good information to make the smart choices. So just because there are more restaurants open up and maybe later, or there are more recreational facilities open up, doesn't mean, especially indoors for both, doesn't mean that you have to necessarily go there. So just want people to know that be smart, make sure that you wear a mask as much as you can when you're outside, away from people who you live with. Social distance as much as you can. If you're going to have any type of get-togethers, outdoors is safer than indoors. And if anybody is sick, please stay at home. Please don't expose anything else. So I think if we stick to those basic tenets, we'll just be safer. But just people should be aware that as our businesses are opening up, restaurants are opening up, amusements are opening up, just people have to be aware that there's still a lot of COVID-19 in our area, and they should act accordingly. Thanks.
Okay, Channel 7, any more questions?
Hi, Mark. Can you hear me?
I can. Go ahead.
So, a good chunk of the Buffalo zip codes that have low vaccination rates were the same zip codes the state FEMA site was originally limited to. And we know back then only about 7,000 of those appointments were booked by those zip codes before it was opened up to the rest of Erie County. So could vaccine hesitancy be part of the reason, or a majority of the reason, that those zip codes are not being vaccinated? And could primary care physicians getting the vaccine help combat that vaccine hesitancy and getting those communities vaccinated?
Well, the answer to your questions is yes and yes. We do know that vaccine hesitancy is a driving factor for some of the lower numbers in black and brown communities. We had Dr. Nylander on here last week to talk about why she believes that people that look like her, as she said, and she's an African American, should be vaccinated. She's an OBGYN, so she was out there telling soon-to-be moms they should be vaccinated. Hesitancy is a concern, and we are trying to go through as many different avenues as we possibly can, including through the faith-based community with pastors. But if you have a question, you should talk to your doctor first. And your doctor is the one who's going to give you the evidence, the empirical evidence as to why you should get vaccinated. So the answer to your questions are yes, we believe hesitancy is driving some of the lower numbers in the city of Buffalo. There is availability in the city of Buffalo. Today we did we're doing a clinic right now at a church in which we didn't get as many people signing up as we originally thought we were going to, and we were able to open it up for the general public as a result of it. So I just want to reiterate to everyone, get the vaccine. It doesn't matter what color you are, get the vaccine. It's going to protect you. And if you have questions, you should talk to your healthcare practitioner. You should talk to your doctor. You should talk to a nurse practitioner that you know, and let them tell you why it's important. If you don't believe me, fine. You should believe Dr. Burstein. If you don't believe her, talk to your doctor. And they're going to say the same message. And we hope that everyone will understand that the vaccine is there to save your life. It's as simple as that. Dominic Lavalo, Spectrum, any more questions?
Yep. This one is more for Dr. Burstein. With now we're a year into COVID, we've heard a lot about long haulers, and now we have a whole new age group of people mainly getting the coronavirus. Have we, other than taste and smell, are there any long haul symptoms that people should be on the lookout for? And with that, for people having those long haul symptoms, what should their steps be to either combat that or just to suppress them, if anything?
Right. So, we know that COVID-19 can infect the central nervous system. That's the reason why people lose their sense of smell and taste. We also know that it infects the heart very frequently, and it can infect many organs. So, besides taste and smell, we know that a lot of people develop fatigue, really debilitating fatigue. Some people develop problems with their heart. They can develop long-term, inflammation of their heart, which can, cause their limitations of activity, shortness of breath. Some people also, because of the neurologic symptoms, develop chronic headaches. So I know if people have been infected with COVID-19, we know sometimes it can take months to return back to normal, and even longer than that. So we really encourage people that don't feel satisfied with their rate of recovery from COVID-19 to talk to their healthcare provider. We know there are clinics opening up across the country. I believe our Jacobs School of Medicine is working to open up clinics, multidisciplinary clinics, to address the health concerns of people who are long haulers from COVID-19, because it is a part of a problem with multiple organs. As I said, the central nervous system, the heart are the most common. So that's why that we really have to be respectful of COVID-19. We know many people are asymptomatic or mildly symptomatic. Some people become very sick and end up in the hospital and die, and some people develop a chronic, sometimes debilitating disease from long-term COVID-19. So there is a wide spectrum of disease, and just because you're young doesn't mean that you're safe from any of those outcomes. Thanks.
Okay, WBFO, any more questions?
Yes, one more. So I saw that on the graph with the different zip codes that a lot of rural communities weren't necessarily doing the best. They weren't necessarily doing the worst. I wonder what sort of outreach Erie County is going to be doing to some of these rural communities that maybe in these communities people don't have a means of transportation to get to a vaccination site in a city or another community. Will we see more pop-up clinics out that way? And to that same point, I wonder too, what kind of outreach is going to be done to other colleges besides the University at Buffalo? Students there, I imagine, might not feel the same pressure as people who are high risk for COVID to go get vaccinated, and so would coming to them be a solution to that? So kind of a two-part question, if that's okay.
Well,
Thank you.
The rural areas, we certainly have done pop-ups in the past, and we're going to continue. We're relying on leaders in those communities to spread the message. I've talked to supervisors in those communities who've been very receptive in trying to get individuals vaccinated, talking to those supervisors and mayors and villages. And they will note that they're doing their best. There's some individuals who just won't get vaccinated. It's disappointing, but we can offer them an opportunity to get vaccinated. We can't force them to get vaccinated. And on the schools and the colleges, we certainly are willing to work with all, but we have responsibility to the general public So we just can't limit our vaccine dosages to colleges. The colleges are going, and for some of these colleges, the students are coming from outside the area. It's better if they get vaccinated in their home community before they come to college than getting vaccinated here. So we're always willing to work with others, but we have a primary responsibility as the Department of Health for the county to provide vaccines for our populace. Just as a reminder, sometimes people forget the size of Erie County. There's 920,000 or so residents, but the county is geographically the same size as the state of Rhode Island. It's actually one of the largest counties geographically in New York State, and for that matter, compared to most states, you could fit 3 or 4 counties geographically into the size of Erie County. So we have a responsibility to offer clinics across the county. We have a permanent clinic at SUNY Erie North. We have a permanent clinic at SUNY Erie South. We have a permanent clinic in downtown Buffalo at the KeyBank Center, and then we do pop-ups. And the pop-ups have primarily been in the city and eastern suburbs and south towns in the rural areas like Concord. So we are getting around, and if we could do more, we would do more, but truthfully, we can't do that much more when you don't have the vaccine supply to meet it. WBEN, Mike Baggerman, any more questions?
Yes, this one's for Dr. Burstein. We have been hearing for months that schools are safe, but obviously the new concern is about young kids catching COVID-19. Is it still believed that schools are safe despite the new information that has come out?
Well, I would just, before Doctor adds, I would note that we've been talking about transmission in schools all along. So not to say they're not safe, but we didn't want people to believe that they were 100% foolproof, because we've seen transmission in schools for quite a number of months now. So I don't know who's saying that they're all safe, and we've heard that from groups, but they're not 100% fail-safe. We know there's transmission in schools in the past, and there's transmission in schools now. So I think it's important for the public to remember that, and our Department of Health has been saying that for some time. Do you want anything?
Sure. Thank you. Well, the county executive is spot on. Just one thing that, schools are just like any other place. They're safe if you adhere to the preventive guidelines. So they're safe if the kids are socially distanced. They're safe if the kids are masking. They're safe if the kids are making sure that there's good disinfectant, the kids are washing their hands. They're actually safer now that the weather's getting warmer if we can open up some windows, both in the classroom and the buses. So there are a lot of things that we can do to make sure that the schools stay safe. Just like any place in Erie County, there are going to be people in a setting that do become infected with COVID-19. However, if we adhere to these preventive guidelines that we know that works, we can prevent transmission within the schools. Thanks.
And last question to Tom from the Buffalo News. Any more questions?
Yes, just quickly for Dr. Burstein.
You should have stayed up.
Are the symptoms that the younger patients are presenting with, are they as severe or more severe than the young patients had in the earlier days of the pandemic before the variants?
Just in terms of the variants in general, the variants that we've seen in our community are really mostly a problem with increased transmission. We're fortunate that the limited number of variant strains that have been identified are not the strains that have caused people to develop more severe illness in general. So just in terms of the the epidemiology of what we're seeing is really kind of the same spectrum of illness as before the variant strains entered our community. It's just we're seeing more transmission in our community. Does that answer your question?
Well, is it a case of people are testing positive, but they're getting really sick, or they're not getting really sick?
Again, it's it's a spectrum. Well, first of all, we haven't identified like a huge number of people with the variant strains, and we haven't. So there, again, we've had been able to test a limited number of specimens, as the county executive mentioned. The last lot, there were almost 30% of the specimens that were tested. About almost 140 specimens were tested. Of those, about 30% were positive. So, again, it's, a spectrum of presentation, but we're not seeing necessarily, a higher prevalence of people that are sick. We're just seeing, the epi has changed. Because so many of our seniors and have been vaccinated, they're protected from developing a severe illness and hospitalizations and death, and the vaccine is working. So now we really need to focus our vaccine efforts on the younger people. Number one, to prevent more community transmission, because we saw from our data that young people in their 20s and 30s are driving transmission. Number two, to make sure that they stay healthy, because we know that people in their 20s and 30s, can become seriously ill and hospitalized. So, we just have to follow that for now. Thanks.
Thank you, Doug.
Okay, thank you all. This concludes our April 6th update. We, of course, if there were any late-breaking things, they'll be released by the Department of Health. I want to thank Karen Gambino from Deaf Access Services for being here today. Thank Chuck and Monica working the screens and making certain everything works well, and Mark Leffler out there, who's always there making certain that we don't have any technical problems with the microphones. Dan Meyer, of course, for dealing with the media, which is a tough job, as anyone knows. And sorry, what are you going to do? But the cameraman's not too thrilled. Anyway, be safe and well all. Take care. I hope everyone who celebrated had a very happy Easter. I want to thank those who didn't go crazy for Dingus Day yesterday. They kept the celebrations down, so hopefully we won't see a big spike as a result of Dingus Day. And most importantly, even if you have been vaccinated, if you're out in public, please still wear your mask when you cannot otherwise safely socially distant. If you can safely socially distant and you're around other people that have been vaccinated, you don't need to wear your mask. But if you are around people who haven't been vaccinated, please wear a mask, because you don't want to catch it and potentially transmit it to someone else, even if you yourself do not really get sick. So take care, everyone. Be safe and well.